Dr. Hinchcliff, where do clinical trials fit into a treatment plan for endometrial cancer?
So I think clinical trials are an incredibly valuable part of a patient's cancer journey. Um, every institution and every provider is going to have potentially different clinical trials available to the patients in their practice. And so it's important to understand what clinical trials might be available to a patient as they, both start their cancer journey, but certainly as their cancer progresses or comes back. Um, I think that it should be something that is on the back of your mind at all phases of a cancer journey. It may not be right for a patient if they are first diagnosed and have a clear standard of care option, but there are certainly clinical trials that add to or investigate what we consider to be the current standard of care to try and move that forward. So even in that first diagnosis phase, I think it's worth asking your doctor what's available to me. And then certainly when a cancer comes back, especially when a cancer has kind of developed resistance to some of the more standard options that we would use, then I think clinical trials are it's an incredible opportunity to have access to a toolbox that you would not have access to otherwise. And so I think that when I think about clinical trials, I think that they fit into all phases of a cancer journey, but that there are certain times in every individual patient's journey that I would say this clinical trial might be right for you at this particular time.
What would you say to patients who are hesitant about trial participation?
Yeah, so I think that that is very common. And what I would say is information is power. I think that if there is a trial that you are eligible for, it's really important to understand what the actual structure of that trial is and also understand what the phase of that trial is. So let me explain those two things because I think they're a little bit different. When I think about a trial structure, I think about what is the trial testing, what is it looking at, and what are the potential arms of therapy. When we say arms, that just means what is a patient going to actually receive? And so some trials, there's only one option. Anyone who's enrolled on the trial gets a certain thing. Other trials have some comparison arms. So some patients that are enrolled get a certain treatment. Some patients that are enrolled get a different treatment. And so as you think about the structure, it's important to know what might I get? Am I always going to get the treatment arm, for example, the drug that's being investigated? Is there a placebo arm, an arm that says I might get something that's standard like chemotherapy, but I'm going to get chemotherapy plus a placebo, which means an inactive agent as compared to chemotherapy plus an active drug. So it's really important to understand the structure of a trial. The second thing that I think is important to understand is the phase. So clinical trials are grouped into phases. Phase 1, phase 2, phase 3 are the most common that you'll hear about. And those are a description of kind of how far along is that particular drug or treatment in development. So phase 1, that treatment is very early. It does not mean that there's not promising data around it, but it means that that drug doesn't have data, for example, in lots and lots of patients with your particular cancer type, right? Instead, usually a phase 1 trial is looking at a drug in humans or in a particular group of tumors, or patients with a particular group of tumors, kind of for the first time or early on. Phase 2 trials are looking at that drug maybe a little bit later after they've gotten some good data, or trying to expand a drug that might have been used in a different cancer type to a new cancer type, for example. And then phase 3 is sort of the bigger studies where you're looking to enroll more patients in a specific cancer type for a specific reason to say, okay, we've had good evidence that this drug has some amount of efficacy. So now we're really trying to look to see how does it compare to what we have out there, and could this help us move forward?